thank you all for joining us. I am Dr. Deborah Hagler. I am the medical director over at Community Health and Wellness and a pediatrician at Mid Coast Hospital. And we are joined by several of our area school physicians, and I am deeply indebted to them for taking time on such a beautiful evening to discuss an issue that's on many of the minds of parents and community members. So I'm just going to start us off and talk a little bit about why school is so important in the world of children. School obviously is an important part of academic and cognitive growth, so how we learn and function in our society. But there's a critical piece of how we grow socially and how our emotions develop in childhood that school plays a critical role in. Additionally, many people aren't aware that children have many critical pieces of medical treatments that happen at school. So many of our children receive physical therapy, occupational therapy, speech therapy, and important treatments for mental health in the school setting. Additionally, many children rely on schools for nutrition. Many need both breakfast and lunch. And I'm sure many of my colleagues here would agree that many of their critical and first important relationships with other adults besides their parents happen within the school setting with a coach or with a teacher. So school is vital for children and for their development. And I think talking to many of our patients, they have indeed missed it in the last several months. So how do you go back to school during a global pandemic? No easy task. And I have to say, probably one of the greatest challenges of my career, thinking about this as a member of the community, as a physician, and as somebody that looks and works in the area of public health. So just briefly, coronavirus, what does it look like in children? Unfortunately for us general pediatricians, it can look like almost anything else that walks through our door. There is a brief period where kids are asymptomatic and adults can be asymptomatic before the onset of illness. And then the most common constellation of symptoms that we see are fever, cough, and chills, but it can come with a whole bunch of other things. So the laundry list of symptoms includes fever, cough, congestion. Something that got a lot of press early on was the loss of taste and smell. When people are very sick, there can be shortness of breath, achiness, vomiting, diarrhea. Children are a little bit less likely to have fever with their illness, and they are. One thing that is clear from a lot of the data nationally and globally is that children are less likely to have severe illness. And indeed, many kids can be asymptomatic. So that is one thing that has been a little bit of a relief. That is not to say that children cannot be critically ill and can get severely ill from this virus. They can, but those numbers have been mercifully small during this global pandemic. So just quickly, a little bit about the epidemiology. Right now, children less than 20 represent about 10% of Maine's numbers. And a little bit, and honestly, this is a novel virus. We are learning as we go. So, tomorrow this all may change. And early epidemiologic studies suggest that very young children, so I'm going to talk in this category about kids less than 10, young children, if exposed versus a 50-year-old exposed in the same scenario, are probably a little bit less likely to contract coronavirus than the older adult. And that young child, so again, somebody less than 10, the early epidemiologic evidence suggests that they may be less efficient spreaders of it than somebody that's older. And in some countries that have already opened schools, we do not think the school itself serves as a prominent part of community transmission. Now, those studies have been done in schools where community transmission has largely been controlled, meaning that there was not raging viral infection and they opened schools. So we think when community spread is low, the school is not going to play a major role in continuing the spread of coronavirus in the community setting. But more to come. Again, this could all change as we move forward. So what are we going to do here in our Mid-Coast area of Maine? So I'm going to just briefly go. Dr. Goodwin is the Brunswick school physician. Dr. Hanna is our RSU 1 Bath physician. Dr. Phelps is for RSU 5 and Freeport. And Dr. Losi is here with us. He is, God love him right now, because he's on call and covering our nursery. And he is the SAD 75 and Harpswell Coastal Academy physician. So these guys are going to briefly speak about what is happening with each school system and some of the safety measures happening at the schools. And then we're going to launch into some frequently asked questions and have a little bit of time, we hope, for some questions at the end from the community. So Dr. Goodwin, I'm going to hand it to you.
Absolutely. So yes, my name is Alyssa Goodwin. I'm the Brunswick School Physician in practice at Martins Point here in Brunswick. And as I think everybody watching is well aware, back to school planning has been ongoing pretty much since the end of school in the spring. And while I think there might be small differences in the implementation in our local school districts, there's a lot of similarities in what you're going to hear tonight. All of the decisions are informed by some pretty robust guidelines that came out and have been revised several times by the Department of Education in coordination with the Maine CDC and the Maine American Academy of Pediatrics. So really trying to get all of the players looking at children's health, employee health, education, all of those pieces together. And so for Brunswick, where we've landed is sort of a pre-K to 5 plan, and then a grade 6 to 8 plan, and then a 9 to 12 plan. The pre-K to 5 in Brunswick occurs over 2 schools: the new Kate Furbish Elementary School and the Harriet Beecher Stowe School. And I believe planning is still ongoing, but Brunswick is proceeding in the pre-K to 5 with a hybrid model with an opt-in for full-time distance learning option as well, with the cohorts being divided AA with Wednesday as everybody home distance learning / deep clean day, BB. So either in school Monday, Tuesday, and then home Wednesday, Thursday, Friday, or vice versa. So everybody who has opted to go back to school in person would have 2 potential days at school. In the grade 6 to 8, it'll be a similar, model of 2 days in school and 3 days at home, similar with that AA, BB cohorts. The learning just looking a little different in its implementation in the middle school because of it's harder to make little cohorts in middle school. The high school is still a plan that's being worked out just by the logistics of high school, and I'm not an educator, and so trying to wrap my head around high school schedules and all of the nuances that go on in the high school, I think that's a little more complicated. But right now, as it stands, the plan as approved is 3 cohorts in person with 1 day each in the school building, and a significant amount of learning happening via distance learning. And you'll hear more about sports and things like that later on. But at this point, that's the planning in Brunswick.
Thanks, Alyssa. And Amina, I'm going to have you jump on with RSU 1.
Okay. So as Dr. Goodwin said, I think a lot of the schools are doing things very similarly because of the recommendations that have been put out by the Maine AAP and the Department of Education. RSU 1 has 2 different learning plans. So one that is for the elementary school and pre-K students, and then a different plan that's for middle school and high school. So for the elementary school students, so the plan right now is to do kind of a soft opening or a slower opening for that first 3 weeks. So in the elementary school, those kids are going to be divided into 2 different groups, Group A and Group B. And each group will attend school for 2 days a week for the first 3 weeks. And those other 3 days, they're not academic expectations. And really this slow opening, the soft opening, is to make sure that the kids understand all the new safety protocols. It gives the staff a chance to kind of work all of that into their day, and really to give everybody a chance to get used to school that really feels very different than it was last year. And then after that third week, the plan is to go back to 5-day-a-week in-person education. So there was space to do distancing for the kids to allow that. The middle school and high school has a different plan. So because of space limitations, they are on a hybrid plan. They will be divided into two groups, Group A and Group B, and they will have 2 days of in-person learning, 2 days of distance learning. Wednesday is a flex day, so that's a day where they could get extra help from a teacher, or they could have virtual office hours with a teacher. One of the things that we did, I think that is slightly different than some of the other districts, is that our groups are going, so Group A will go to school Monday, Thursday, and then Group B goes Tuesday, Friday. And the decision was made for that because we, number one, we could do the cleaning, so that was okay. But also it felt like it was important, at least in our school district, to make sure that kids didn't go too long without having contact with their teachers and their guidance counselors and the adults who were kind of that secondary safety net beyond what their parents are. So that's the way our school district is starting things. There is an option for families who feel that distance learning is the right thing for them. There is an option to be 100% distance learning if that's what they feel is appropriate.
Great, thank you. And Steph, I'm going to have you jump in and talk a little bit about RSU 5.
Sure. So RSU 5, Freeport Pownell Durham, is opening all grades in a hybrid model. So all grades, it'll look a little different from elementary to middle school to high school, but they're all on a similar plan where everybody is going to school in two cohorts, either a Monday, Wednesday, and every other Friday, or a Tuesday, Thursday, and every other Friday. So each student will have 2 to 3 days of in-school learning, and then 2 or 3 days of remote learning each week. And then there also, as Dr. Hanna had mentioned, there's also an option for families that choose to do a full remote, supported remote plan as well for families that choose that. There additionally, which may be in the other districts as well, there's also an option for kids that have been identified that have significant, that get significant assistance during their school day. They can go to school 5 days a week.
Great.
That's the plan for now.
Okie doke. And I believe SAD 75 is doing something similar with a completely remote option, and an option for hybrid is being offered in as well. And I'm going to just flip us to some of the frequently asked questions, because this is going to get to some of the issues around safety as we guide students through these different combinations and some of the choices that families will be asking for help as they make some complicated decisions. So Alyssa, I'm going to ask you to guide us through the first 3 questions, and then we'll go from there.
Okay, absolutely. So, it's been interesting again, and I think that probably Dr. Hagler, Dr. Hanna, and Dr. Phelps would probably echo this, that participating in all of the practice and statewide and even national work groups that we have been working through this summer has really just highlighted what a complex issue this is, and just how much thought and consideration has gone into the return to school. And now we're sort of at the implementation phase, and the reality of just all of this planning and what does it look like, and how do we actually make these morning to morning decisions at home of, do I send my kid? Are they sick? Sort of how do I approach this? And so I think it's really important, before we think about these next couple of questions, to just really understand that in the pandemic world that we are living in, and going back to that slide of common presentations in kids with COVID, it's really striking to reflect back to what Dr. Hagler said about we don't really know what COVID looks like in kids a lot, because we haven't seen a lot of kids with COVID, right? We shut things down, kids have been largely home. And while we've seen a slight increase in illness this summer with camps and school and daycares and things, it hasn't been COVID related primarily. So we as parents, we as providers, we as school population, we'll just need to think differently about what may have been minor cold and flu symptoms in previous years that may warrant a much more significant workup and isolation, letting those symptoms play out. So with that, I'll get to my question. So we think about the high risk populations as those that are sort of more medically fragile. So in my practice, I'm thinking about my high-risk asthmatics, the poorly controlled asthmatics, really trying to get their asthma plans in a much more robust place to make sure that we've got a proactive plan. We're thinking about our immune suppressed patients, whether it be through chemotherapy or other processes. And we're thinking about our diabetics, and then we're thinking about our kids that may have more complex, as Dr. Phelps was just mentioning, developmental or physical limitations. And so with that in mind, what I've recommended with my patients is anybody that has, complex cardiac, is for things that are sort of primary care based, like asthma and things like that, that folks should talk to their pediatricians. And for kids that do have, like I said, oncologic processes or on chemotherapy or have diabetes or other more complex medical conditions, that they really talk to their specialist about the decision about whether or not it's safe for their child to return to school this fall. So that is my answer to the first question. In terms of when should my child stay home? So like I said, this is gonna feel really different this year than it has in the past. Because when we look at what are the more potentially significant symptoms of COVID, it doesn't have to be a high fever, a shaking chill, and a terrible cough. Kids can present positive with COVID with simply a sore throat. So there's a pretty great resource that the practices are using, as well as the school nurses have access to, and I think will probably be provided to parents as well. But it does include a lot of the minor cold and flu symptoms that we all usually sort of muscle on through in the cold and flu season. So this year in particular, if you're not sure, you should probably check in with your primary care provider. And if you're not sure, you should err on the side of caution and keep kids home until we figure this out. But again, it's going to just look and feel really different this year than it has in the past. And so that ties into the next question, which does my child need to come into the doctor's office if I think they have COVID-19? And the answer is probably, but what that looks like depends on the symptoms and severity. So there may be times where kids have symptoms that they don't feel really sick, but they hit the threshold for our screening, our swabbing protocol. And so both at Mid Coast, Maine Health, Martins Point, all of the practices have really robust processes for assessing who needs to go to the respiratory clinic as well versus who needs just a test. And there may be kids who are not clinically unwell enough or sick enough to warrant an office visit, but absolutely need to be tested. And then followed via, either phone calls or telehealth, or again, lots of creative ways to take care of kids. Obviously, kids that have an underlying medical condition or have more significant symptoms absolutely need to be seen. But I think that this is going to be a fall where we're just going to have to work together, and there's going to be a lot of communication between parents, school nurses, providers. And like I said, I think it's just going to be a year of probably second guessing and checking a lot more for those minor cold symptoms. So with that, I'll stop.
And Alyssa, can I just, one other thing I just want to add is if you happen to be tested for COVID, you should wait at home until you get those results. That's a really good point. We've seen that play out with asymptomatic travelers, right? Showing up, having a negative test, right? And so if we're talking about symptomatic, so there's sort of two categories of testing. There's the asymptomatic because of travel, vacation, or an exposure, and that kind of goes into a different group. I'm thinking about kids that have a runny nose, a sore throat, or a cough, right? So the return to school is going to require a provider note following sort of a scripted guideline that's again coming out of these work groups through the CDC and the American Academy of Pediatrics and the DOE, because again, we really want everybody following the same guidelines, following the same rules, because we all have to be doing the same thing to make sure that all of this work works. So correct, if you have a child with, for example, a sore throat is a more significant symptom on the
on our workflows. And so a sore throat, gets a COVID test, wait for the results, and then symptoms improving. So there's sort of a series of checklists. And again, a return to school will be accompanied by a letter that sort of addresses this process. It's a really different thing than, your typical cold and flu season. So absolutely. Thanks for making that point.
Yeah, thank you. And Amina, so we sort of dabbled in one of your questions. Sorry. So we're gonna throw the next three to you, I'm seeing more and more questions come into the chat box, which is good. So
the next question is, does my child need a note for school if they're sick? And I think the answer is the majority of the time it's going to be a yes. So as Dr. Goodwin said, that there are symptoms that are considered low-risk symptoms. There are symptoms that are considered high-risk symptoms. If you have one low-risk symptom, and again, I'm speaking for our district, if you have one low-risk symptom, so say you have a headache and you have nothing else, you didn't develop a fever, you developed no other symptoms, you were home for your 24 hours, which is that expectation. We want you home for 24 hours just to make sure you're not developing other things. And your symptom has improved, you could go back to school, and you don't necessarily need a note from your doctor for that. But if you have, so again, a couple of the low risk criteria, or you have one of those high risk symptoms like a sore throat, or you've lost your sense of taste or smell, then you are shunted over into kind of a different way of being evaluated. And so absolutely, you're going to need, part of that is going back to school, you're going to need a note from your primary care doctor just stating that either you were tested for COVID and you were negative, and again, as you said, you stay home until you get that test, you were evaluated and there's some other diagnosis and you don't think it's COVID-19, or if a family chooses not to get tested or not to be evaluated, then we have to treat this as if we think you may have COVID-19, and it means you need to be home for a minimum of 10 days from the onset of your symptoms. You need to be at least 24 hours fever-free without any fever-reducing medications, and your symptoms need to have improved. And you need a note from your doctor also, or your primary care provider. So yes, the majority of the time you're going to end up needing a note. And again, this is going to feel very different than years past, where you might have a fever for a couple of days and then it's gone and you go back to school. We really, really want to have a tight handle on the illnesses that are in our community and making sure that kids are staying home and not potentially infecting others. So second question, how can I make sure my child is as healthy as possible and stays that way for the upcoming year? I think a lot of this is doing things that as parents you've always done. Make sure that they have a healthy diet, make sure they get exercise every day, make sure they get a good night's sleep. Sleep deprivation can affect your immune system, so have them get a good night's sleep. You've already given them a good immune boost that way. So those things are really important. A big one is vaccinations. I think families have been busy with lots of other things. Life has been disrupted since March, but it's important to take a look at your child's vaccines and just make sure that those are up to date. And that really includes getting a flu shot as well. Kids can get influenza and COVID at the same time, and those kids can be very sick. So we really want to make sure everybody's getting out there, getting their flu shots. And then some of the things that you do to keep your child healthy are things that are new to us, but things that we have really been doing since March to keep all of us healthy, to keep our community healthy. Teach your child to wash their hands well. Teach them to sing happy birthday twice while scrubbing away at their hands, not the ch-ch-ch and done, really do it well. Teach your child to wear a mask and be a role model with that. We've all been wearing masks because we know it protects those around us, but there's information out there that suggests the person wearing the mask is also protected. So if you can get your child to wear a mask, you're protecting their friends, you're protecting their teachers, but you're also protecting your child. So that's really important as well. And then we as a community really need to keep doing our part, keep avoiding the large crowds, observe the physical distancing, and be good role models and be positive about it, because our kids see us as role models and they'll mimic what we're doing. So if we can kind of help them with all of that, I think this just makes the process a lot easier and helps to keep them healthy. Okay, I think I have one more question, right? Yeah,
You do.
If my child gets COVID-19, when can they go back to school? Okay, that's my short answer here. So, so if they have a positive test and they have symptoms, they can go back to school when they are a minimum 10 days from the onset of their symptoms. They are also 24 hours, at least 24 hours fever-free without any fever-reducing medication in their system. And that's really important because fever-free with ibuprofen in your system doesn't really count. And then their symptoms need to be improving. So that's the criteria if you have symptoms. Say someone travels out of state and they come back in and they're tested and they don't have symptoms, but they have a positive test, they need to quarantine at home for 10 days from their positive test. So those are the current guidelines. As we all know, things are always changing, but right now that is the expectation if you have a positive test.
Great. Thank you, Amina. All right, Stephanie, I'm going to hit them home to you. You have the last three. So what if my child is exposed to COVID? When can they go back to school?
So if your child's exposed to COVID, then you will receive a call. First of all, from the CDC letting you know that your child has been exposed, and they will help you through that process. But ultimately what it's going to look like is that your child, whether they have a test done or not on themselves, will need to be home for 14 days from the date that they were last exposed to the person who was positive.
Let me ask you a follow-up question. If you get tested and you have a negative test, can you get out of your quarantine?
No. You can't.
Okay. How can I help my child wear a mask?
So the biggest thing is, as Dr. Hanna said, is role model. And so you can help your child with wearing a mask by wearing one yourself, by modeling that behavior. Talk about it with your child. They see people wearing masks. They see hopefully you wearing masks, and they themselves have hopefully been had the opportunity to wear masks this summer. And I think children at this point, they expect, if you've been showing them that you go in public, you're around other people, you wear a mask, that it would probably make sense to most kids that if they're going to return to school, that they're going to be wearing a mask. But just discuss that with them, reinforce it, practice. If your child hasn't been wearing a mask and had that opportunity this summer, to start practicing now. Start with small amounts of time. If your child doesn't tolerate it well, give them a break, and then encourage them the way you would encourage any other behavior that you want to see from them. And just to build up that time. You also can experiment with different masks, different cloths, different textures. Make them fun. Let them decorate them, write on them. Pick out, help them help you pick out a mask that has a neat fabric or something that they like. Or if it's your teenager, somehow they decide to pick one that looks cool. That's basically, and then just continue to reinforce it with them, that this is important and this helps to keep us all healthy.
Great, thank you. And then finally, and this is no small question to ask, because we are all drowning and swirling in a lot of anxiety around COVID itself, but particularly there's a lot of anxiety about going back into the classroom. It's going to look different, feel different. They haven't been in school for a long time. How are we going to help kids and families cope with all of this anxiety?
So the first thing goes back to role modeling again. Kids feed off of our anxiety. And so the more anxious we as parents are about our kids going back to school, the more anxious our kids will be. And in kids, that anxiety won't necessarily look the same. They may not say that they're worried about it, but they may have a tummy ache every morning, right, before school. And kids often have this anxiety anyways as the school year starts. And so just like with any other year, you talk to them about the school year starting, talk about the positives, kind of get them excited for it. Talk about how school's going to look different to them this year. The more that kids can understand what to expect, the more comfortable that they'll be. And then the counselors at every school are prepared for this. They have already been talking and working and thinking about how to help kids with all the anxieties they usually come to school with sometimes at the beginning of the year, but in particular, the anxieties that are COVID related. And so if you have particular concerns about your child and that their anxiety you feel like is going to prevent them from going to school, that's something you want to talk to their primary care provider about before school starts, and even to consider giving a call to the school's counselor to talk to them beforehand and to see if they have suggestions as well. But the biggest thing is role modeling.
Great. Thank you. Thank you all. And we are going to touch on sports. Go ahead, Alyssa. Go ahead.
Add one more thing about the anxiety, just as I was listening. And then I do want to talk about sports. These are my two favorite topics. But I was just thinking about, when we think about back to school, we're really thinking about, for most kids, I think, kind of a dual track of what back to school looks like. We're going to have our back in the classroom, in our masks, 6 feet apart from our friends, figuring that out. And then we're going to have our distance learning days. And I think the reality is that even in districts where they're going back 5 days a week, kids are going to be home intermittently and unexpectedly because of their, potentially, hopefully, minor respiratory symptoms. So at some point, everyone's going to be doing some distance learning to some degree. So I've been taking a lot of time in my practice, as I'm sure my colleagues have been as well, to really think about how to approach distance learning with a different sense of engagement and mindfulness, and get ahead of some of the anxieties about going into distance learning. Because a lot of my patients, I think because that it happened so abruptly, so unexpectedly, and we were all kind of scrambling, that I think a lot of kids are a little traumatized, and probably educators, from the distance learning experience. And now here we sit almost 6 months later. And so I've been talking a lot to my patients and my children about trying to work on their sleep habits, make sure that they've got good transitions out of bed into school when their school is in their house. Trying to create like a good workspace for their distance learning days. I've talked to kids about taking a walk to school, getting up, getting breakfast, walking down the road or the driveway if their neighborhood supports, and coming back, or biking to school, or just things like that, because we know those movement breaks are going to matter. And then as they're working their way through the schools, I know the distance learning days are really being thought about in terms of quantity as well as quality. So really trying to have robust learning come back, but also being mindful about screen time, because the worry, of course, is that kids are on Zoom or Google Classroom or whatever platform schools are using for 6 hours a day, and nobody wants that. So like I said, I wanted to kind of add that piece to the home learning days, just because I think we all have a little bit of shared anxiety around, at least I do, supporting distance learners. Like, this is not where I thrive. So just thoughts about that as well. So anyways, I digress.
No, that's a really good point, Alyssa. Thank you for bringing that up. It's a new part of the equation that I think all of us are really getting used to.
Yeah.
Just like telehealth is a new part of this equation that we're all getting used to, that it will be a valuable tool, but there's a learning curve. So let me have you dive into sports, because there's one question already that I've seen
about
in the
sports.
chat. Yeah.
And, okay. So sports, fitness, athletics, it's really something I have a passion for. And so I was really happy to try, and I don't think I have very many answers, but I at least wanted to make sure that we had this addressed. And so I understand that, so there's sort of two pieces. In Maine, there's youth sports, which have been happening to a large degree much of the summer, and they all have their own, I don't know what the right word are, the sort of guidelines and processes and things that they have to follow. And so baseball, I think there was some hockey, there was a variety of things. And I think they were able to sort of work it out with their own restrictions and guidelines, and it happened, and it was great. And the high school sports and the school sports are high school, middle school sports are a little bit of a different thing, because they are under the, I guess they're under the umbrella of the Maine Principals Association. And so there's been, I think most people are very aware, a lot of work, a lot of angst, a lot of anxiety, a lot of just worry about protecting those high school, middle school sports, but also making sure that we're keeping our young athletes safe. And so I understand, although I didn't have a chance, because I think it just came out today, that there were some guidelines released by the MPA. But I believe I got a preview on them last week. And so really looking at sort of the type of sport, the type of risk, and how to mitigate that risk. I know, of course, all parents of high school athletes are aware that the preseasons were all pushed back, the start of seasons were all pushed back. I know in our area, we're looking at a couple of different counties and different, I don't even know what the right word is, Class A, Class B, all of that sort of stuff. So we're sort of looking at all different ways that that's being implemented. But as of right now, it sounds like they're really looking at the sport individually, the risk factors in each sport individually, and really how to mitigate that risk. So, sports where there's contact is going to be a higher risk than a sport where there's no contact. Contact where they're sharing equipment, sports where they're not able to maintain a 6-foot distance, sports that are inside, all of that sort of stuff. So I think there's going to be a lot more about this coming out. I think the bottom line is everybody wants kids active. Everybody, I think, that's trying to make these decisions and promote, safe sport is really looking at how do you keep kids active? How do you keep kids engaged? We know there's such significant mental health and physical benefits to participating in sports, but also make sure that we're not doing things that aren't unsafe, and also not taking too many steps at once. We want to get kids back into school, but we also want to keep them active. And if you do everything all at once, you just run the risk of causing more problems. The good news is that the high school sports in this area anyway have at least been back to practices, not full practices, not full pads, not in the locker room, all outside, but that teenagers have been able to gather with coaches' supervision and do some skills and drills and trainings, and we haven't seen a bump in the numbers. So I think there'll be some sort of a modified season. I just don't know what that'll look like. So I'm sure there are more questions than I have answers to, but I'm happy to take a stab at them as they come.
Okay, thank you. Well, I'm gonna move through just some quick safety measures for the community, and then we are gonna have probably about 15, maybe if I go fast, 18 minutes for some questions to go through the chat box. So just some final thoughts as a community, because the cliche, it takes a village, has been ground up, chewed up, spit out, and goes around. But I really, truly, firmly believe that is true. So we all have a role to play in this. So families, as part of their role, can really things are changing. So try their best to stay up to date with what schools are doing and what is happening on the ground floor in your community and statewide. And again, I think all of my colleagues here have really mentioned the importance of getting a flu shot. The more people in the community that get the flu shot, the better our herd immunity is, the more we protect everyone. And again, because COVID is going to look a bit like the flu, it's going to help us sort some of this out, but there is no rule that says because you got coronavirus, you're not going to get the flu. You can get both, and it's not going to be fun. The other thing that is getting more and more play, particularly in the public health world, about keeping people safe, are stable cohorts. So if you can think about protecting small groups of people, really keeping your school as a bubble, your classroom as a bubble, keeping everybody in that little bubble safe, really trying hard to protect them, and keeping that area safe, making sure everybody is participating in the activities of masking, good hand hygiene, trying not to get into large group gatherings, is really going to be critical for keeping the classroom safe. And again, as several of my colleagues have stressed, normally we muckle through a lot of mild symptoms and go on with our world, but it's going to be important this year to that little scratchy throat, to stay home and think about getting it checked out, because this may be very, very mild in many people, but yet they could come into a building and spread it to others. Just again, really hoping people will think about our schools and our children as part of a large community bubble that we're all trying to keep safe, to keep our community and our school community and all of the people that participate in the education of our children that are giving so much, and to keep them safe. So we have some resources here, and that will be on the Community Health and Wellness website. And I'm going to ask Melissa to help me dive into questions. And again, there was one of the first questions that I may, with my exquisite technological skills, have inadvertently erased was a question about team sports and how do we keep kiddos safe with team sports. And I think, Alyssa, you addressed some of that, but my understanding is there will be some significant modifications to how those are played.
Yeah. Yep. I didn't get into the details because like I said, when I heard on a couple days ago wasn't official, and I think things will continue to change. But I think that again, each sport and every sport is going to have modifications. So I'm the mother of a runner, which seems like a pretty low risk sport. But when you think about lining up at the start line of a, cross country meet, there may be 150 kids shoulder to shoulder. So that may look like staggered starts or only certain runners running or not, traveling, because then you have to think about the bus and the locker room and all of that sort of stuff. So I think that for each sport, it will look different. And again, the reality of how that plays out as we return to school may be different than even what's planned. I think what we've seen repeatedly, thankfully in Maine, with largely continued positive movement, is that we make a decision, we implement it as a community, we watch the numbers, thankfully they've been stable, and then we're able to take the next step forward. So I think the recommendations that are coming out right now from the Maine Principals Association are really looking at modifying and mitigating risk in team sports, which again may be revised again. So again, depending on your sport, it's probably going to look and feel different. And so, full contact football, full throw-in, I don't know if they're allowed to head in high school, or corner kicks, things like that, volleyball, those are sports that there are going to be modifications because, again, of the risk of whether it's inside, whether it's the contact, whether it's the shared equipment, whether it's the spacing, that sort of thing. So I think there'll be a lot more information coming out to all parents of high school athletes from their athletic directors in the next couple of days with what the current status and planning is going to be. And just be aware that it's probably going to change. But I think there's still a lot of benefit to kids participating even in a modified way if it's safe. So.
Okay, you guys. So I'm going to ask all of you to comment on this. There was a question about isolation rooms within schools for kids who may have been COVID symptoms and spacing for multiple students. And all of you have probably talked to your school nurses a little bit about this. And I'm just wondering if you have feedback for parents about multiple students being in the same room until they can be picked up, and if you've heard any policy or comments about that at the school level. And I'll just give it to all three of you for a quick word on that. And you may not have the granular detail.
I'll go first to say that, because I think that this is probably generally true for all of us. I've walked through every school, I've walked through every nurse's office, and for each school, it's a different scenario based on the space that they have available to them, and mapped out what's going to happen, not only when the first student comes in, but what's going to happen when the second and the third student comes in who needs to be isolated. So at each school, we have a way for it to happen so that students are not closely together, that there's good ventilation, that we're even doing some assessing of kids outside with the nurse's office, waiting potentially in a space that's outside if it's weather cooperating, kind of a day. We're going to be having them put their cloth mask in their pocket and putting on a surgical mask when they come in with those symptoms, wash their hands, and then they're going to be calling and asking parents to come pick up their student as soon as possible. And more than ever this year, that's going to be really important, the timely pickup of our sick students, so that we have as little of a backup as possible. The nurses are going to be doing a lot of cleaning in their offices. They already did, but they're going to be doing a lot more and a lot more often to keep the spaces safe.
Yeah, and to echo that, I think it also really speaks to some of the discussion earlier, which is really, again, thinking about those morning symptoms that you're sort of like, are you really sick? I don't know. Like, this is the year to say, let's just keep you home and let's see how the day goes. Because again, what we know is that our school nurses, even before COVID, were out straight between, checking diabetic blood sugars and administering medications and dealing with, the injuries, and then this past flu season was pretty tough even before COVID. So the other thing that I think speaks to Stephanie's point is that really, I think there's been a lot of effort at all of the local school districts to make sure that all of the parent contact information for the first, the second, the third, all of the, who you can contact, because I know in the past our school nurses at times will have difficulty connecting with someone, and that's just not going to be possible, because once a kid is identified as having COVID symptoms in school, like Stephanie said, they're going to put their cloth mask away, they're going to be put into an isolation room without other children. I agree that is obviously not anyone's goal. And I think if we do things right at every step of the way, because this isn't just a school issue, it's a community issue. And so we all have a responsibility in keeping it safe. So.
And agreed, in terms of just making sure that, again, echoing what Dr. Goodwin said, really, if you think your child may be coming down with something, they need to stay home. And again, we are working on, in every school district, how do you keep kids separate? You are expected to put on the surgical mask if you're sick. We've talked about using face shields also within our isolation room, just to protect each individual child against any just an extra barrier, an extra active barrier there if more than one child is, or even if just one child is in the isolation room. So those are some of the things that we're also doing.
So I'm going to dovetail with that. I'm going to throw this out to everybody, but because I think, again, this mirrors what everyone's saying, but there is a question. And this is going to be part of the connecting with your primary care office, which means that, and I'm going to just put a pitch out to the community to be patient with the pediatrician's office. Call for your refill a few days early, because it will be busy for all of us. But if someone seems to have mild allergy symptoms and they've got that runny nose, are you going to send them to school right away? I'll throw that out to you all and have you comment on that first, based on what our discussion just was, and then how do we help families do? There's a lot of discussion about this. So, whoever wants to start off with that from I'll let you guys go.
Go ahead.
Sorry, I don't know who was starting.
Go ahead, Amina. I'll let you start, Amina.
Okay. I think that in years past, mild runny nose, you could chalk it up to allergies and you'd say, okay, I'm just going to go ahead and send you. I think this is just very different. And if your child has the mild runny nose and you think it's probably allergies, it's also still probably appropriate to monitor them at least for the 24 hours. Make sure that's what it is. Try your allergy medicine, see if things improve, see if they're developing some other symptoms before you send them into school. Because allergies and early COVID or signs of COVID can look similar. So we all have to have kind of a heightened level of awareness that these symptoms can appear very similar. And you're really trying to make sure that we're not spreading anything to the other kids, to the staff. So again, I think even if you think it's allergies, I think there should be just maybe a step back, a pause. Let's just make sure we're not developing anything else over the next 24 hours just to be safe.
Yep, I would echo that. Yeah, I was going to say almost exactly the same thing. And when you look at our sort of workflows, runny nose is just, it was difficult to sort of process when that was added to the list of COVID symptoms, but as a standalone, it is in the lower risk symptoms. And so kind of back to what I was saying about some of the higher risk, not that allergies are higher risk for COVID, but really kind of getting back to that, like maximizing your child's health. If you know that every September 1st, your child has horrific runny nose, sore throat, itchy eyes, their allergies are terrible, this is probably the year that you're going to want to treat those allergies. Whereas in the past, you might be able to let them ride because they're not too terrible. Allergy medications are largely safe and pretty well tolerated. But yes, this is the difficult part about all of this. And we just can't take risks, and so we all have to think about our responsibility differently, because allergies, the flu usually hits a little harder, but allergies, cold symptoms, sometimes even strep, even before COVID can be hard to tease out. and we just can't, take risks. So I think very much to Amina's point that if you're not sure, even if it seems like it's your child's typical presentation with a simple runny nose and improvement with allergy symptoms, that does not put you on a COVID path. If you were to have a runny nose that the next day you had a sore throat and a cough, well, that's a different story because now you've got 2 more significant COVID symptoms. And so that does require an evaluation and a test in the pathway that Stephanie talked about previously. But I think that's the way to be thinking about it, is that we just need to be honest in our assessment of our health, our children's health, and what we're sending to school.
And then you guys, thank you. And I'm going to just throw out, there's questions about ideal timing for flu shots. And I'll just ask, Steph, what are you talking to patients about for ideal timing for their flu shots this year?
So to get them when they're available.
Yes, absolutely.
And so there's some talk that they may be available a little bit earlier this year than usual. They may be available so that people can get the flu shots in September rather than October or November. And so I've been recommending that as soon as those are available, that everyone go ahead and get them. And every practice is going to have its own strategy for how it does flu shots and flu shot clinics, and schools doing their typical flu shot clinics, but that as soon as you start hearing that flu shots are available in the community, if that sign goes up at CVS or wherever, that flu shots are available, to give your pediatrician's office a call or look at their sites online to see if they've yet posted the availability for when you can get those.
That's a great answer, because hopefully we will have lots of high demand. Yeah. Anybody else with a comment there?
I would totally agree with that. I've said to exactly what you said, Stephanie, that this is a year that I think on the earlier side is better just because we're taking this step back into school. And I think that there's a lot of work going on with our home health nursing agency colleagues, and looking at really creative ways to vaccinate kids. And then what I've said to my patients, I think in pediatrics is a little bit more difficult because you can't always go to CVS with a child. I know we're looking at, I'm sure you guys are as well, ways to do mass vaccinations without bringing hundreds of people into the office. So we're looking at sites to do drive-by clinics, which is funny. A lot of my families are like, this is great. I can just load everybody up in their car seats and just drive on through. And so, but I think we're all giving the same message. And which is really important, because what I've said to my patients pretty much this whole time is every sore throat and cough is going to be complicated. So every sore throat and cough we can eliminate is going to make all of us feel a little bit better and be healthier. So. And
then you guys, I think we have time maybe for a quick question. Oh, Amina, were you going to jump in?
Yeah, I was going to jump in on one thing. So I generally have been recommending that parents get them if they are available in September. And the one reason that I have, because I know some of the pharmacies actually have signs up about flu shots and have for the past month. But there were some of the studies that did suggest that you get like 6 months of really good immunity with your flu shot, and then your antibody levels can start to drop a little bit. So September is a great time that gets you through much of cold and flu season. I do worry about some of those pharmacies that are offering them in June and July, and is it the updated vaccine? Is that going to get you through all of cold and flu season? So anyway, that was my 2 cents worth there.
No, it is a really good point, because you want it to hit you and get your peak during the peak time when we're seeing flu peak in Maine. Thank you for adding that. I'm going to just add one quick question, you guys, that was here. And I, you know what, I'm going to answer it. So there's a question about exposure in the classroom to someone that does test COVID positive, and what will happen then if everybody else in the classroom was following all the guidelines, distancing, face masking, etc. So we know that potentially could happen. There could be somebody that inadvertently follows all of the rules, and still somebody ends up in a classroom with COVID. The CDC will investigate their contact tracers, and a CDC investigator will come in and investigate exactly what happens, and will determine who qualifies as a direct a direct exposure and contact the families. So likely the chances are high that everyone in that classroom would be considered a close contact of that exposure. But it may depend. In some cases, they will go in and look at the desk setups in certain circumstances. So, but there is a good chance everyone in that classroom would be considered a close contact. But the CDC will determine that from their epidemiologic investigative crew. I am going to say that we are done for the evening, and there are definitely excellent resources available at the main CDC website, the main AAP website. We will have the webinar recorded and available on the Community Health and Wellness website. And I again want to express my deepest appreciation to Drs. Goodwin, Drs. Hanna, and Drs. Phelps, and to Melissa Focusata for just running the magic here this evening at Community Health and Wellness for this webinar for our community. More to come from us. We will be talking about, particularly about flu vaccine at next month's webinar. But thank you very much for joining us, and be safe out there and be well. Thanks so much.